My name is Bethany Huffman. I work in the emergency department as a registered nurse, and I have been with Wright River Health for 6 years now. I've been a nurse for 7 years. I've been in emergency medicine though the entire time I've been a nurse, straight out of nursing school. That's where I went. I actually started my career here at Wright River Health. I left for a year due to a job change with my husband, and then we came back. ER medicine is something that I said from the moment I chose nursing I would never do. And the first day that I went into my emergency room rotation in nursing school, I said, this is it, this is home for me. The pace is different, you never know what you're gonna get. I love murder mysteries, so that kind of, the not knowing and the having to put everything together kind of related to stuff like that, because you don't know what people are coming in with. You have to figure that out. It's like a big mystery that you have to solve as to what is going on with them. The ER team, we're like a family. We've really worked on building our team specifically over the last couple of years, but the ER people, we are just those people that if you're having a bad day, they are the people that you want to talk to. They're the people that know how to help you get through it. They're the people that will come around you and say, you know what, I know you're struggling, let me help take some of the load off. So ESI levels are the emergency triage levels. So we have 5 levels in emergency rooms, and it's based off of kind of a different number of factors. One thing would be vital signs, the other thing would be what complaint you come in with. It's basically a way for us to tell how critical you are. So an ESI level 1 is our most critical patient. I kind of describe that to our new nurses as, this is the patient that if you don't do something right this second, they are going to die. Our ESI level 2s are kind of they're still critical, but you've got a little bit of time to work with. Our ESI level 3s, that's kind of where the focus shifts a little bit. Your level 1s and level 2s are your critical patients. Your level 3s are more based on how many resources you're going to use on them. So that would be our abdominal pains that maybe are not critical right this moment. You might think of that like an appendicitis patient. So we're gonna do multiple things on them. We're gonna do blood work, maybe a urine sample, a CT, because we're using multiple resources on that patient. That makes them a level 3 patient. So an ESI level 4 would be a patient that maybe we're gonna use one resource on. So if you come in and you think you broke your foot and we're only going to do an x-ray, that's an ESI level 4. An ESI level 5 would be somebody who comes in that maybe they have chronic pain. And we know why they have chronic pain, but we're not going to do a lot of testing as to figuring out why they're having that pain. We may just give them a medication and send them home. One is that we care. We care about our community. We care about making sure that our community is safe and that they're taken care of well. Sometimes that doesn't translate very well, because in one room we can have a patient who is dying that's taking all of our resources, and in another room we've got a patient who is very scared and feels like they're dying, but right now maybe the vital signs and all of the other factors aren't there, so we have to focus our resources on the patient that is currently actively dying. So just because you don't see a nurse or a person for a while, that doesn't mean we don't care. That doesn't mean that we don't want to take care of you. It may just mean that there is somebody else there who would need our time and attention right this second, whereas you're okay right now. But we do care. We do want to take care of you, and we want you to feel safe and heard, and like we actually want to pay attention to you, because we do.